Welcome back, everyone. My name is Melissa Simon, and I am a George H. Gardner Professor of Clinical Gynecology and the Vice Chair of Research in the Department of Obstetrics and Gynecology at Northwestern University Feinberg School of Medicine. I'm also the founder and director of the Center for Health Equity Transformation and the Chicago Cancer Health Equity Collaborative with the Robert H. Lurie Comprehensive Cancer Center. I am a member of the Workshops Planning Committee and the National Academy's Roundtable on the Promotion of Health Equity. During this next session, we will first hear from Sarah Guia of Changelab Solutions, who will provide her reflections on today's workshop. We will then invite back some of our workshop speakers for an audience Q&A. Please type your questions into the chat box, including the speaker it is directed to, and we will share them with the speakers during the Q&A portion near the end of the session. Full bios of all of our speakers today are included in the meeting materials on the webpage for this event, linked through the chat box. It is now my great pleasure to introduce today's keynote presenter, Dr. Sarah Guia. Dr. Guia is the Chief Executive Officer of Changelab Solutions. Please join me in welcoming Dr. Guia. Thank you for joining us.
Thank you so much, Melissa. And while I would gladly accept the title of Dr. Guia, I am only Sarah Guia, CEO, as I'm an attorney. But I very, very much appreciate the invitation to be with you all here today to share the perspectives of Changelab Solutions. So I'm going to advance my slides today, and I'm going to just take a moment to share my screen so that you can all see the presentation. Great. Well, again, thank you so much for having me today. It really is a pleasure. Just a note that I don't have any disclosures to name today. So my name is Sarah Guia. I'm the CEO of Changelab Solutions, and I've had the opportunity to work at the state, local, and federal levels to advance law and policy to support communities of color. And in the areas that I focused on, they've included advancing law and policy around affordable quality healthcare, as well as equitable public health efforts. So again, thank you for inviting me here to share my thoughts and my organization's insights. I want to take a moment to acknowledge my colleague, Kimberly Libman, Vice President of Policy, who partnered with me in preparation of this presentation. So for those of you who may not be familiar with Changelab, we're a national, nonpartisan, nonprofit organization that uses the tools of law and policy to advance health equity. We have an interdisciplinary team of lawyers, planners, analysts, and other professionals that work with community organizations, governments, and anchor institutions to develop and implement equitable policy solutions. We focus on demystifying law and policy because they're powerful tools that often are not accessible to the general public, but they can do a lot in terms of helping to undo historical harms, affect large numbers of people, and engage change makers in the policy process. So with our interdisciplinary approach, we work to connect across different sectors, which we've heard a lot about today. And we want to help to increase their understanding and ability to address equity issues. We also focus on legal and policy tools at the local and statewide levels, because again, as was talked about today, that's really where people feel and touch those policies so much more personally. And we seek to strengthen leadership and capacity through technical assistance, training, and TA by really developing policy and legal tools that elevate practical, evidence-based, and community-centered solutions and successes. So I want to take you on a little journey through Changelab's work, because there are some observations here today that were named in the room, or in our virtual room, and also because I think it will give you a little insight into just the journey that we've seen both as an organization, but also in the broader field of public health. So I'm first going to talk a little bit about Changelab's trajectory on obesity prevention and how we've pivoted as an organization to work on the fundamental drivers of health inequities and how that shows up in our legal and policy solutions. So after talking about our trajectory of work, I'll then share some concrete examples of innovative policy solutions that we think have been able to really utilize the foundational drivers, which I'll speak to today, as well as have the potential to limit or prevent obesity. And I want to name that throughout the presentation, you'll hear the ways in which data and communications have really been effective in driving our policy solutions. So our work really begins with our founder, Maris Ash, who was instrumental in establishing the innovative approach of Changelab. As an attorney, she believed that public health practitioners and the field in general could really benefit from the idea of using the tools of law and policy to advance the public's health in new ways. So the idea for Changelab came when states were beginning to win lawsuits against tobacco companies and found themselves with additional resources to support prevention of tobacco use. With our early partners and mentors at the California Department of Public Health, Changelab shared innovative approaches to tobacco control, including land use and zoning regulations, First Amendment and consumer law, sales regulation, as well as the ability to levy taxes and fees. At that time, we were primarily a technical and legal assistance provider to health departments across the state on how they could use these legal and policy interventions. And we wanted to have the departments look at policy systems and environments, not just at education and outreach. So as the field of public health began to take notice of the rising rates of obesity in the early 2000s, the team saw the opportunity to apply our lessons learned in tobacco control to obesity prevention. And at the time, our work focused on much more downstream drivers, things that we've talked about today, like access to healthy foods and opportunities to be active. With this focus, we were successful in connecting the sectors of public health and city planners, for example, and we used data to make the case about the important role that environments play in health. So through public health scientists who were making connections between suburban sprawl and auto dependence, along with the rising increase in chronic conditions. We also started thinking beyond just technical assistance, because the general public and policymakers and others didn't always get the connection between health and environments. And so we really started to look at communications as a tool to help us make the case about why environmental changes were important. So with the grant from the Robert Wood Johnson Foundation, Changelab was able to finally make our scale up to the national level. And we worked with practitioners and doctors and community organizations and academicians. We gathered data across the field, particularly the burgeoning food and obesity movements, to really help us understand how lawyers could help. And our early policy wins included, were really how to focus on children and environments in schools, restricting fast food offerings, and then also moving towards complete streets models to ensure healthy environments. But despite these efforts to change policy systems and environments, health disparities amongst Black, Indigenous, and people of color, BIPOC communities, as well as low-income communities, they weren't changing. And in fact, they were actually widening. These health disparities were really widening. And so along with our funders and our partners and our researchers, Changelab staff, who were becoming much more diverse, began to draw on their own legal, professional, and personal experiences, combined with research, such as the frameworks that I'm listing here, to really inform the ways that our organization would integrate equity into our law and policy frameworks. So for example, as an RWJ grantee, we learned about and followed the work of Dr. Shriki Kumanyika and her policy interventions framework, which provides a way to actualize or operationalize health equity rather than just talking about it. Her foundational premise is that we can't address disparities related to obesity and other health challenges without addressing the underlying health inequities. So her framework includes policy solutions that integrate traditional public health interventions like increasing healthy options and reducing deterrence to bad foods and whatnot. But it also centers community within policy solutions by drawing a focus to improving social and economic solutions at the individual and community levels. So for us at Changelab, this framework really helped knit together the important role that community engagement plays in developing policies and practices. Again, we've heard this theme today about engaging the stakeholders and particularly engaging communities. But it also helps to not just inform the policies. It also helps to build social capital, increase community cohesion, build confidence and trust in governments, and build upon community strengths and assets. So the framework also calls out the need to, and I quote, use a set of field glasses that allows one to see both overt and subtle injustices at work, and to reject stereotypes that blame people for circumstances beyond their control. So again, taking that framing, as Jeff mentioned earlier today, away from the individual focus and much more on the upstream factors or some of the systems level challenges. Our staff, a few of whom also hail from New York, were very much influenced by Dr. Mary Bassett and her colleagues, who in their 2017 article drew the connection between the impacts of racism on health and made the connection between historical racist laws and the policies, as well as the pathways that lead to disparities. So the article defines structural racism as the totality of ways in which societies foster racial discrimination through mutually reinforcing systems of housing, employment, earnings, education, benefits, credit, media, healthcare, and criminal justice. These patterns and practices in turn reinforce discriminatory beliefs, values, and the distribution of resources. So what was called out there is the idea of structural racism is that all of these factors are working together at the same time to influence somebody's health or to influence certain people's health. They're like a ball of yarn that's woven together and that you have to unravel piece by piece and work on in order to really understand. And it calls into play these different systems that are all, again, working together. The article makes very clear these pathways between racism and health, specifically calling out the targeted marketing of health-harming substances like cigarettes and social sugary sweetened beverages. It talks about the role that political exclusion plays. And right now we've seen, again, the rising voter restrictions that are happening across the nation. And also talks about the role that state-sanctioned violence and alienation from property and traditional lands, including the use of eminent domain and the forced removal of Native Americans, all of those policies and those systems have resulted in the health disparities that we're seeing today. The article also provides examples about why having an equity lens is really important, because seemingly race-neutral policies, for example, employee protections that carve out particular groups of employees, such as agricultural workers or domestic workers, when you look through it using an equity lens, you can identify that there are certain people who make up the majority of those kinds of employment positions. And so therefore it's going to have a disproportionate impact on BIPOC communities. And the last framework that I mentioned is a trauma-informed approach, which is newer to Changelab. And we're just beginning to really test the way that trauma-informed approaches can also help us think about policies in a different way. It really encourages awareness of the impact that trauma can have on communities. And it centers principles like safety and trustworthiness, peer support, collaboration, employment and choice, empowerment and choice, as well as cultural, historic, and gender issues. So these kinds of seminal reports were really important to us as an organization because they provided, again, the data and the evidence that we sought in order to support our work to move even farther upstream. And that led to the publication of the Blueprint for Changemakers in 2019, which posits that if we want to address health, we must focus on the drivers of health inequities. And this work really helps us realize that rather than focusing just on the prevalence of a single disease or a condition, that we need to change the distribution of healthy environments, of economic resources and opportunities. And in 2020, we also, as an organization, made a statement about racism as a public health crisis, and we named it as an organizational priority. So at Changelab Solutions, we believe that laws and policies are powerful risk factors for poor health, because they have been what has perpetuated racism, discrimination, and segregation in our nation's history. And so in order for us to achieve health equity, we have to address what we call the fundamental drivers of inequity, which we name in the Blueprint for Changemakers as being structural racism and discrimination, income inequality and poverty, disparities in opportunity, disparities in political power, and governance that limits meaningful participation. These 5 drivers shape the places and the social environments and the living conditions. And they also shape people's daily experiences and are often the lens through which individuals and communities experience and understand their physical surroundings, their situations, and their life circumstances. So they're not distinct phenomenon, but they actually overlap and they really influence and create those systemic challenges. So what this has done for our organization is to really allow for us to adopt equity-centered frameworks and equity-centered strategies. And the way, along with our policy systems and environmental changes. And the ways that we think about this is that an equity-centered strategy is one that really focuses on reducing inequities in health by going beyond just the environmental and settings-based interventions that have become the preferred public health intervention. And instead, it looks at the social and political pressures or policies for changing social determinants of health. And most importantly for us, it also it applies a human-centered approach to identifying and prioritizing interventions that will have the most benefit for those who have been disadvantaged. And in the Blueprint for Changemakers, we offer several different frameworks and approaches that again center people and communities that have been most impacted by injustice, such as using a health and all policies approach, an ongoing and more deliberate community engagement process, and focusing on local solutions. We also have menus that track policies to the 5 drivers to understand what are the levers that we're pressing for those different types of drivers. So now I'm going to shift into the examples of the systems, environmental, and policy changes. And I want to just name that for our organization, again, we're really centering equity and thinking about ways in which we can dismantle structural discrimination and racism, and importantly, build on the strengths and assets of communities. So these are some examples in which we've used an equity-oriented approach to help identify solutions that are both effective at preventing or reducing disparities, as well as building or supporting communities that have been most impacted by structural barriers. So the first I want to name is an exploratory research project that we did using a trauma-informed lens to look at WIC policies. Now, from a data perspective, WIC serves about 7 million low-income breastfeeding and pregnant women and children who are up to the age of 5 nearly every month. Almost half of all infants who are born in the United States benefit from WIC. Nearly all people who participate have low income at about either at or below 185% of the poverty level. They're all women or infants, and Latinas make up about half of those who are enrolled. So we use a trauma-informed lens in our analysis of the WIC policies because food insecurity is a form of trauma, and it's associated with traumatic experiences that can have an impact on child development and health. But it's also possible that these kinds of food assistance programs like WIC are potential points of intervention to prevent trauma as well as re-traumatization of individuals and families. This approach centers the people who utilize WIC, and we're hoping that it would lead to policy recommendations that maybe a traditional public health analysis wouldn't necessarily identify. So one of the goals of the WIC program is to support breastfeeding, and we really support that goal. And as we were using the trauma-informed lens, our policy scan found that there's some policies that offer more generous food allowances for women who fully or partially breastfeed compared to those who do not. And the policy doesn't necessarily consider barriers to breastfeeding within that policy that may be out of the family's control. Additionally, there are very few exceptions within the food packages for families of different cultural groups. including food options for religious observation or for families that choose vegan or vegetarian options. So using a trauma-informed lens would seek to preserve WIC food participants' ability to maintain a sense of control and choice. And we might be, in including their participation and feedback in the administration of the program, we might be able to have them help us understand how to formulate food packages and eligibility lists, as well as breastfeeding supports. And a result is that even within the community, we might find more supports that are both supporting the women in the program, as well as immigrant-run stores or kosher-run stores. So this work in particular is in the early formation, and it may be a little controversial to some, but I think it's a good example of how we can use an equity-centered approach and a trauma-informed approach to look at a system that could support, empower, and build health while also addressing structural racism or structural discrimination. The second example I want to give is centered on local sugary drink taxes. And this came up today, and I know that it can be controversial in the sense that it can be seen as a potential a regressive tax on low-income families. But as was mentioned today, the research has shown that increasing taxes on SSBs does lower consumption. And there's an organization in Berkeley that used a different approach in order to advance this policy. And that's what I want to talk about today. So previous attempts at leveraging a local SSB tax had failed, and I think in large part because the industry had been successful in messaging to BIPOC communities that their rights were being taken away and their choices were being taken away. But a group of advocates came together and they engaged communities in a different way. The first approach was that they actually educated communities, particularly youth, about the roles that SSBs play in contributing to diabetes. And second, they pointed out larger structural issues, such as the targeted advertising to Black and Latinx communities that industry often takes. And third, they asked community members if they were to raise taxes on SSBs, how would that money might be spent? And then fourth, when they created the policy, they created an advisory board to help them distribute the funds. So as a result, from what I can see in some of the recent publications is that it seems that consumption is down, but really what we're finding is that resources are going to the communities that really need it the most. And so if I harken back to Dr. Kumaniki's framework, we're both deterring some of those harmful products, but we're also building the individual and community capacity and engaging them in the process along the way. So I also raise this issue because preemption is at play here again, in the sense that a few years ago within California, our state legislature took action to prevent any further local taxes on SSBs across our counties. And Changelab is currently in the process of challenging that law through litigation as a way to preserve local choice. And again, just speaking to the relationships and the connections between law and policy, and ultimately the resources and how they get distributed at different levels. The last example I'd like to talk about today is really an example that comes from a community-centered approach. The work grew out of a documentary that featured young youth within New Jersey from ages 12 to 21. They produced a documentary that showed how community assets could, if community assets were really the focus, how they could transform the city's structures and systems to be able to enhance food security. And they conducted several community convenings. And in partnership with the RWJ Barnabas, a healthcare system there in New Jersey, Changelab was able to identify any of the legal barriers that they needed in order to create and expand urban agriculture, to be able to produce additional farmers markets, and also to produce or expand community gardens. So I want to name, community engagement has not necessarily been a focus of this particular conversation, but it comes up over and over again in a lot of different ways, because community engagement does cut across all of these examples. And it also cuts across the use of data and policies, as well as communications and the role that community needs to play. So I'll just put these here as an example of some guiding principles that we've identified in our blueprint for Changemakers, and you can read more in that document. And just a couple of final reflections that I wanted to name today is that communications, I see these as all interrelated, right? Policy solutions, communications, data, and community engagement, to me, they all go hand in hand in order to advance efforts to prevent obesity. And the presentation on communications offered some great insights on the role that communications plays on two really important audiences, policymakers and the public. And we've done some research on tobacco control and some of the frameworks that are used. We worked really closely with the Frameworks Institute that mirror some of the findings that were raised today. We need to talk about the issue from a perspective of fairness and justice and give examples of industry practices that really drive disparities, but also offer those policy solutions that can affect disparities. Importantly enough too, we can't use a crisis mode, right? Speaking to the juxtaposition of the public health perspective on don't take obesity lightly versus the happy-go-lucky kind of industry, portrayal. Communities they want to see the assets and their strengths and their opportunities uplifted and policy solutions really centered. I also want to speak to the notion that our communities are not monolithic, right? And particularly our BIPOC communities are also not monolithic, and that we have to build relationships and dig deep and understand which each of our communities, what's their love language? What are the things that they really want to hear and to see themselves reflected in our communications? And lastly, just to point out that communications and advocates can and really do need to work hand in hand. And there's opportunities for communications to lift up those policy solutions that are working really well, either through storytelling or also through rigorous evaluation like legal epidemiology and other evaluation tools of policy solutions. In terms of data, we all know that our data systems are not up to par, and COVID really demonstrated that. I've been working on data collection issues most of my career, and we've got to make a move and prioritize that. But the second thing is that I really saw some exciting potential opportunities to engage schools and clinical settings in new ways around obesity prevention. And from the school's perspective, similarly to thinking about WIC as that point of intervention, I think schools are also a potential point of intervention. And I think it's important for us to really, as in public health, think about how we work with other sectors and also speak to each other's languages, translate for each other, or get on the same page about the kinds of language that we use, and be mindful that that's going to either draw in colleagues, but it could also push out colleagues. So how we talk about our work and how we frame up our work using communications is really important. I also want to note that in preparation for this, I read several articles on artificial intelligence or AI that shows that some of those, again, seemingly neutral kinds of analyses could have bias baked into them. So for example, using cost as a data source could actually skew results more positively towards whites than blacks, because African American and other BIPOC communities have often been turned away from the healthcare system, incurring less costs over time. There are a lot of structural barriers to our healthcare system that are not necessarily reflected in our current data. And so we need to be mindful about where data comes from. And then finally, community-defined data is really important. So I think Colby raised the idea that history is data, right? We need to identify and hear the stories and really give rigor to community-defined data and community-defined practices in helping us develop solutions. Because again, community are experts in their experiences and in the policy solutions that will work the best. And finally, in terms of policy solutions, we're beginning to see the data that is reflecting on why equity is so important. And so, we're raising to the point of really needing to understand, in terms of policy solutions, the role of government, the role of implementation, really important, and the role of preemption, right? Really important factors that were raised today. And then, of course, we can't forget community engagement, which really, again, should be centered. So I'll just note that I have a few examples or a few resources that I'll share these slides, including some resources on preemption as well as our blueprint for Changemakers. Please stay connected, and thank you for the opportunity to share our organization's perspectives today.